there's no safe way to boost your testosterone levels.
I mean, I guess it depends on what do we mean by safe. You know, when we think about like testosterone replacement therapy, so we do a lot of TRT. So that could be like injections, gels, you name it. That is a safe way, right? Like realistically, you do proper TRT, right? You're measuring your blood work. You know, if you're doing injections, you're doing it properly, you're cleaning the area. You know, that's a safe way of boosting your testosterone. Now, is there a way to naturally boost your testosterone? That's probably, probably what we're getting at.
Yeah.
We don't really know, right? There's all these boosters that are on the market. A lot of times, a lot of these supplements, supplement market is highly unregulated. We don't know what's in it. Not great data for it. So something that we don't really know. But so in that question, we don't really know if there's no natural ways. I always tell patients in terms of just lifestyle aspects that can help over time with sort of getting that testosterone up, and that could be getting proper sleep, diet, exercise, weight loss. So those are definitely the important pieces.
So when you talk about natural ways to go about it, a lot of people, or at least the ones that are not in the medicine world, they say if you're injecting yourself with testosterone boosters, that's not a safe way to go about it, right? That's not natural, quote unquote. What are your thoughts on that?
Yeah, I guess it all depends on what we're talking about, right? Like natural, for sure. Like if you inject yourself with like exogenous or testosterone, it will shut off your own testosterone production, right? But in many cases, it's a vital, replacement hormone. I have some patients, they come in and their testosterone is low and they're like, what can I do about this? And I'm telling, well, get back in the gym, start exercising. They're like, I'm so tired. They're like, so you're trying to tell someone to lose weight and exercise when they don't even have the energy to do that. So that's what I think about the testosterone replacement, is trying to boost them up, give them the energy back to make those active changes in the lifestyle. And I've seen a lot of patients who, they've taken that and they've ran with it, right? They feel so much better. They're going back to the gym. Then you have other patients who don't, right? They're like, I like how I feel. Haven't really changed my lifestyle, but maybe I'm going to have to be on TRT for life, right? So there's kind of different ways of approaching it. Ideally, you replace them, get them back to kind of as much as peak health as they can, maybe slowly wean it off. And then there's going to be some people where it's going to be hard to wean off. Right?
I guess it also depends on the type of person coming in, correct? Like someone who may just want to be active versus someone who's training for a bodybuilding competition, right? In the world of, let's say, like muscle mass and like getting your summer body right, or looking, is that a route that people come to you and ask you about, like saying that, hey, listen, I've been trying to gain muscle for this many years, I want to get bigger? This is
not really.
No.
I would say 9.9 times out of 10 the patients that come in are going to be those who have some of the signs. Certainly there's going to be some patients who are looking for that. We have pretty strict guidelines in Canada, and people may find them pretty restrictive because of how the testosterone is sort of regulated. So we have to be careful with how we prescribe testosterone. So we do make sure that they have either like biochemically low testosterone or a combination of signs and symptoms. But very rare will patients come in looking for trying to get that beach bod going.